have spent more than 30 years of my life studying the brain. I have always been curious as how we can improve our brain functions as we get older. Can we improve our memory? Can we be sharper? Can we sleep better? Can we be happier? So my studies began when I was at Harvard Medical School. I actually studied the different neurotransmitter receptors in the memory part of the brain called hippocampus. When I started my residency training at Johns Hopkins Hospital, I continued to explore how we can improve our brain functions. I remember that I was working in the Alzheimer's Disease Research Center at Johns Hopkins, and I saw many patients who were diagnosed with Alzheimer's disease but had conditions like obesity, sedentary lifestyle, congestive heart failure. And I felt like these people should not be diagnosed with Alzheimer's disease. They have good reasons why they can't remember. If there's not enough blood supply to the brain because of their heart failure or diabetes or obesity, it's obvious that their cognitive functions will not be good. So then I started to wonder, can we reverse the process and see that people's brain functions would improve? And guess what? This is exactly what happened. As I studied, I realized that improving vascular health, improving things like more exercise, better sleep, reducing stress, meditating individually can improve brain functions. Then I thought, well, why don't we combine all of these into one comprehensive program? And that's what I did. In 2011, I started to put a 12-week program where I would have my patients meet with my brain coaches and work on their diet, exercise, and sleep. And I saw that they did have improvements. These were elderly people in their 70s and 80s who started having better memory, they were happier, they were sleeping better. And I actually gathered the data and I published my first paper in the Journal of Prevention of Alzheimer's Disease in 2016. 84% of my patients had improved, and many of them had experienced growth in the part of their brain for memory called hippocampus, the same part I had studied when I was in medical school back in the late 1990s. Then I thought, well, what if we provide this program for patients with concussion? And as expected, many patients who had persistent concussion symptoms for months or even years improved. The results were really too good to be true. But they were true because when we did statistical analysis, we saw that more than 80% of patients had improvements in objective cognitive testing. Not only they said they felt better, but the test results showed that their brain functions had improved. Recently, I provided this program with children and adults who have attention deficit disorder and saw that they too had significant improvements when their diet, exercise, sleep, and stress were improved, and they were able to work on their lifestyle, and as a result of those changes, had better brain functions. I published one study in the Journal of Rehabilitation in 2020, and my other paper about how this program can help patients with memory problems, patients with concussion, and patients with ADHD will be published today. So I'm super happy that what I thought would happen did happen. What I thought that patients can improve their brain functions by improving their lifestyle choices, by eating better, by exercising more, by reducing stress, these things did work. This program does work. And there are no medications involved in this program, and there are no expensive surgical procedures. Most of these things are non-drug interventions that people can do on their own. In other words, these interventions are readily available, they're simple, but they are powerful, and they can improve your brain and your cognitive functions at any time. The program consists of twice weekly interventions where people get brain training and they receive coaching for better sleep, better diet, and more exercise. And at the end of the program, they repeat the same testing that at the beginning so we can see how much they improved. These are kind of things that I will talk to you more in the coming videos. Okay, I look forward to giving you more details next time.